one of my favorite joints are what we call tendon gliding exercises. And what tendon gliding exercises are, and I'm just going to actually show your audience. You start with your hand in this position. It's totally straight. That is an exercise because most of the resting position is at about this place. So if you drop your hand down by your chair, you would see that your hand is slightly bent. So to ask someone to do this is an exercise. And then what we do is we go into bending the middle joint and the tip joint as much as you can. And a lot of times, even with arthritis, one side of the hand is affected more than the other side. So you can always compare and contrast that I have a little bit more on one side versus the other. And then what we do is we go back to this position, and then we go into what I call the tabletop. And even I have to get some help there, but I'm just bending just this middle part of my joint here. And we hold that. And I should say with these exercises that you should not do them quickly. You should actually hold them for at least 5 seconds and then go into the subsequent ones. And then I usually go back to this, what I call neutral position. And then I go down to what I call a straight fist, where I'm taking the tips of my fingers and trying to touch the base of my palm. Okay. And then after that, I'm going back. And I always say the goal is always to be able to make a full fist, even though you don't want to always use your full fist in arthritis. So I ask my patients to go to a hook fist and then curl in to make a full fist. That is one of the exercises that we do a lot of. We actually measure every joint. So wherever we see a deficit, we try to set up a home exercise program. That is our primary one for the smaller digits. One specifically for the thumb, we have 1, 2, and then 3 joints in the thumb. So we isolate each one of them so that we actually get motion.